The diagnosis of Fragile X syndrome should be considered for any male or female with developmental delay, intellectual disability, features of autism spectrum, or extreme anxiety and behavioural problems. For a lot of GPs, the diagnosis of intellectual disability might involve a more professional assessment by an educational psychologist or developmental paediatrician. The other reasons to think about Fragile X syndrome are where children or adults of any age present with ongoing learning disabilities or behavioural challenges, where there's a family history of Fragile X syndrome or intellectual disability, if someone's been tested with the old karyotype test from before the mid-1990s, any of those conditions would mandate referral to a pathology laboratory for DNA testing for Fragile X syndrome. It's very important to look for a diagnosis of Fragile X syndrome for two reasons. The first reason is that knowledge about the condition will allow people to accurately offer targeted treatment and management strategies for that condition. The second reason is because this is a genetic condition, it will run in families, and diagnosis will allow people to discover if they do or don't carry the gene and make appropriate decisions around family planning. Family history is very important in Fragile X syndrome. Whilst 30% of people who are initially diagnosed don't have a known family history of Fragile X syndrome, that should not deter any person from requesting DNA testing for a person who has developmental disability of any sort. The other role of family history is once someone has been diagnosed, it's very important to go through the entire family looking for other people that may be affected with either intellectual disability, learning problems, autism spectrum disorders, or in some cases difficulties with fertility and Parkinson's-like syndromes. Once the diagnosis of Fragile X has been confirmed, it's important for the GP to realise that the news can be devastating for a family. It's vital that they reassure the family that there is a lot that can be done in terms of treatment and management strategies, and to offer the family, the extended family, full support through the grieving process, which can take a year or longer to go through. It's equally important to ensure that the multidisciplinary plan is put into place and that the family is supported implementing that plan, again, through the following years that will follow up. Whilst many carriers of a genetic condition don't have any symptoms, with Fragile X syndrome, there is certainly a percentage of people who may be affected. Both males and females may have difficulties with learning, may have behavioural issues such as autism spectrum disorders, anxiety, and behavioural problems. Females in particular may present with anxiety and depression, executive function defects which will manifest as difficulties with planning and organisation. And again, females may have difficulties with fertility. Older males more than females may present with movement disorder diseases, with Parkinson's-like symptoms, with ataxia and tremor. For this reason, women who present with fertility problems or older people over the age of 50 with Parkinson's-like symptoms, with tremor and ataxia, should be referred on for DNA testing for Fragile X syndrome. GPs play a very important role in managing families with Fragile X syndrome. It's primarily around multidisciplinary care. In Australia now, we're able to do care plans, which involve calling the family in and making sure that the entire spectrum of allied health and specialist referrals are implemented with the family's agreement and followed up on. GPs also need to make sure that they are supporting the family through the various emotional turmoils that are associated with both diagnosis of this condition and the various problems that their family members will present with over the years. It's also very important that GPs be aware, as this is a gene which is carried through families, that all family members who may carry the gene are offered testing. Family members who may decline initially need to be followed up with over time, and often only the GP is in that position to follow a family and make sure that they are offered that option of testing. So expanded carrier screening is currently being introduced into Australia. This offers people before starting a family or in early pregnancy the option of being screened for a large number of genetic conditions, including Fragile X syndrome. It's very important for GPs to be aware that this is an option to offer women considering starting a family, and it can be done ideally before pregnancy, but it can be done in early pregnancy as well. It then offers families the full range of options for family planning.